let's talk a little bit about physiology, and I'm going to try to keep this short and sweet so we can move on. So, blood flow is a volume of blood flowing through veins, organs, and the entire circulation in a given period. Blood pressure is a force per unit area exerted on the walls of the blood vessel by the blood. This is normally shortened to just BP. And the resistance, and this is essentially peripheral resistance, is a measure of the amount of friction blood encounters on vessel walls, generally in peripheral system circulations. So, in layman's terms, this is essentially the opposition of flow. Now, blood pressure is measured in millimeters of mercury. We essentially don't really use that as much anymore, but it's still expressed as that. They're measuring, when we're looking at what we're measuring here, we're looking at systematic arterial blood pressure for the most part, right? And it's essentially a gradient. So when we talk about resistance or the opposition of flow, there's three things that essentially resist flow. One of them is blood viscosity. So this is just how thick or sticky is a blood. And essentially this can be due to plasma proteins or formed elements. And essentially this is going to increase as viscosity increases, resistance increases. So viscosity, you're thinking about something like water is not as viscous as maple syrup. Maple syrup is much thicker. So you can see how that could essentially relate to how hard it is to push blood through your body. The total blood vessel length, the longer the vessel, the greater the resistance it's countering, because the longer it is that you're pushing through it, right? So as you start, essentially, the thinner, essentially, the diameter is going to get. And that's the third thing that essentially is going to be important in resistance. This has the greatest influence on resistance. So you're going to have more resistance the smaller the vessels are. So the closer you get to the capillaries, the more resistance you're going to have. Systematic blood pressure basically is just the action of the heart actually pumping that generates blood flow. And that resistance essentially makes the pressure. The resistance of the blood flowing is what causes systematic pressure to begin with. It's the highest in the aorta, the pressure is, and declines throughout the pathway. So the steepest drops actually include, when we look at in the arterioles, just because of the fact that essentially that is the farthest from the body. And so we're talking about arteries here. So you can look at the amount of pressure that you have, and if you think about it in terms of how far away you are from the initial beginning of it, it's going to make sense. So this is directly out of the heart right here, right? So the pressure that you're generating here is essentially the highest. And as you can see here, that essentially it drops off the farther you get away from it. Now, I said earlier when I was talking about veins, essentially, that the closer that you are to the capillaries, the higher the pressure. And it makes sense. These are the smaller ones, and yes, these become bigger, but the biggest point here is essentially you are getting farthest away from the initial pumping out. So this is the farthest, from the heart. So essentially you get the least amount of pressure. So in here, if blood pressure increases, blood flow should increase. If peripheral resistance increases, so this could be something like a blockage or something, then you're expecting blood flow to decrease. So peripheral resistance is the most important factor that influences local blood flow. And essentially our arterioles and arteries and vessels in general can rely on this. They can constrict to make it go faster. They can dilate it to make it go slower. So it's very much a dynamic process. So when we're talking about constriction and dilation, essentially we're talking about it in a local area that can basically make it dynamic into how fast or how slow, but overall pressure remains the same. Now, the blood pressure within the arterial is determined by the two main factors: the amount of blood that is essentially leaving, right? And that's the volume that's being forced out at any one time. And you could think about the stroke volume, how much they're pushing out at one time, right? And the overall is the cardiac output. And the elasticity, right? How basically elastic are the arteries at the time. Now, the blood pressure near the heart is pulsatile, and that just means it raises and falls with each heartbeat. But overall, at a system level, it's pretty averaged out. So systolic pressure is essentially the pressure exerted in the arteries, or the aorta, sorry. And this is during basically the left ventricle pumping the blood, right? And so the average of this in a normal adult is about 120 millimoles mercury, or millimeters of mercury. Diastolic pressure is the lowest level of aortic pressure. So this is essentially when the heart is at rest. Now, pulse pressure is the difference between systolic and diastolic. Now, the pulse itself is just the throbbing of arteries, right? We can feel this. We did this in lab. And this is due to the difference in pulse pressure. And you can feel this right under the skin. And the mean arterial pressure, or MAP, is essentially just the pressure that propels blood to tissue. And this is very, very steady. It's non-pulsatile, right? It means that it's not going to fluctuate at all. And the pulse pressure phases out near the end of the artillery tree here. So basically, MAP pressure is very, very steady pressure. Now, MAP pressure and pulse pressure both basically decline the farther you get from heart. And vital signs, we took those when we were talking about clinical monitoring. We did these in the lab, and you can take pulse and blood pressure along with respiratory rates and body temperature to get an overall idea of how healthy someone is and how functional they are. When you're taking a pulse, you can do the radial pulse, which is normally taken at the wrist. This is the most routine. Pressure points, areas where arteries are close to the body surface. You can compress these to stop the flow in the event of a hemorrhage, and so you can take pulses there as well. and they're just kind of looking at the different areas. And of course, there were for the popliteal artery we did not look at, and the femoral artery we didn't look at, but all of these other ones, for the most part, pressure points you were looking at. And you can take a pressure cuff and essentially look and examine what the systematic arterial blood pressure is indirectly by looking at these. Essentially, you wrap them, and as you go high, you go to the point where you can't hear any sound anymore, and then you release the pressure, and at the point where you can hear the first beating again, that is the systolic pressure, the highest pressure that you record. And then essentially you keep going until you can't hear the sound anymore, right? And the pressure is really slowly, and you basically listen for what's called sounds of cough. So with your stethoscope. So the systolic pressure is normally somewhere around 120 mm of mercury, and the diastolic on average is 80 millimeters of mercury. And that is essentially where I'm going to stop on asking anything about veins and arteries. You can review over the rest of the PowerPoint slide. A lot of this that affects blood pressure, we are going to talk about when we get a little bit later, so I'm not too concerned about not covering some of these things. So at this point, we are going to be done for the lecture and what I'm expecting you to know on veins and arteries. So thank you guys, and I will see you tomorrow.